Have large hot coffee, cream and sugar, please. That's it, thanks.
Wanted to. Yeah, only for the vote we need. Are we on? Yep. Hi, good afternoon. Everybody can hear us. Hi, Susan. Thank you for joining us.
Hi, Susan.
Okay, so we'll start by going over quick over.
Yeah, just repeat.
Answer. See if Sandy goes.
The answer is Dave's not muted, that's the problem.
Am I supposed to be muted?
Bob Hankey's right.
So that wasn't the answer. Well, it could be.
We don't have feedback now.
You don't hear
We're
me.
fixed.
If I don't come through, it's fixed.
They're all frozen.
Yeah. I think so. It's no, it's like I can't like
We're good.
we talked and then we
Still feedback.
heard ourselves in the meeting like 3 seconds later.
That's wrong.
Yeah, we have a record. Never.
Matt, we're not frozen. We're all fine here. We can hear.
No,
We're video live, audio.
I can either look at it on Zoom or I can look at it in the front. I gotta close one. So
It's about
browser already.
It goes like this for a second.
Yeah.
Yeah. No, it's amazing stuff. You just said that. You said that right now. And it's almost a minute ago.
Okay. I think that's the answer. Browser and Zoom.
Oh, there we go.
So now are we better live better now?
We're good.
Griffiths is still
Now
insane.
the level, I think we're nice. Yeah, I think we're good. Yep. Okay, thanks, man. Bye.
We ready? Okay. Guess we'll start again. Susan, if I could introduce you to start with. If you'd like to introduce yourself, that would be great. I'm glad you joined us today.
We're not here.
Okay, I unmuted myself finally. Okay, I'm Susan Savage. I work at the New York State Department of State. I work on the countywide shared services initiative, and I'm just here in case any questions come up that I can be helpful with. Your planning process is your own. Obviously, you've been involved in the program a couple of times, and you know, I'm just here in case a question comes up that I could help answer. Because even though we do this every year, sometimes the details change a little bit, or we forget what it is we did in the past. So just happy to help. And and answer any questions if they come up.
Thank you. I'm gonna just go over a quick overview of what the actual program is. I don't think we have to go too detailed because we, like you said, we've already been through this a couple times before. So we invited today all the town supervisors, the village mayors, and we are required in order to participate in the shared services to have 2 panel meetings, one of which is today, 3 public hearings, and then at the end, 1 panel meeting vote to actually adopt the plan. And just to remind everyone, the items that we submit have to involve at least 2 government agencies, must be described in the adopted plan for that year to be claimed for that year. Participating entities must be specifically listed in the adopted plan in order to be claimed. And they must be either new actions or new participants in existing programs. Must result in recurring taxpayer savings extending beyond 1 year. And cost savings can only be claimed for one of the 2 12-month periods. One is from January 1st to December 31st or July 1st to June 30th. And the value of the equipment savings for 1 year period is determined by the annual IRS depreciation rate based on the type of equipment.
Actually, that's no longer the IRS rate. I didn't update that part.
Okay.
It's now the New York State finance law.
Finance law. Okay.
Make it better.
It gives things have a lot longer life span in New York State.
You get a little less money.
If you're only able to claim 1 year's worth of value, if it has a longer life.
So we're convening today in order to discuss different options that you may have, that you know, projects that we might be able to submit in the plan. So that's what we're here for today. I don't know if anyone has any ideas you'd like to discuss. We know, might as well start off right now. We know we have one, right, in the works, which is the town barn in Fort Anne, the DPW town barn, which the county and the town will be sharing on construction. So that is one item that we are going to submit in the next plan. You want to go over some examples of the ones that have gone through before?
Yeah, good. County assessing as a service was a good one. We had Fort Anne and Cambridge do it the very first year. And that is where the town, for one reason or another, no longer chooses to have a town assessor, and the county takes over the assessing through the real property tax office. Make an agreement with real property for a per parcel price for the assessment. And if the rate the county is giving you is lower than what you were paying, what your cost to have the assessor in your town was previously, then you have a savings, and that savings for 1 year is eligible for the shared services reimbursement money. So we were successful with that. This for 2022, the town is doing tax collection to the treasurer's office through an agreement with the treasurer, and that is the same idea. Instead of the town doing it themselves, the county is taking over the service, able to offer it at a cheaper rate, and the town has some savings there, which is eligible for one-time shared services reimbursement, I guess, match. Let's call it savings match. Right. Another one that was successful was 5 towns getting together and purchasing one piece of equipment that they all share. They have an agreement in place for the equipment's use. They do the purchase, split the payment 5 ways, split the insurance 5 ways. That one was unfortunately one that was affected by the change in the depreciation schedule used. When we initially applied for it, it was the IRS schedule, which gave the equipment like a 6-year life. So they get a 1/6 of their value back for sharing. And then we switched to the New York State finance law and the shared services law, and it was like a 50th or something. So there was a big difference there. It was more than half the value not able to be reimbursed, but they did get something because they were sharing. The difference between everybody buying their own piece of equipment or everybody sharing the same was how they were able to get the shared services matched. And then there's the reval project, which we all know the 6 towns did the reval together, and we were able to get 1 year's worth. That one is also depreciated, which it wasn't in the IRS table, it's in the New York State finance law. So that was again a time when it was a little less than we were expecting for the match, but we were able to get it.
Have we ever got what we expected any other times?
Maybe the first time when we did assessing as a county service with Cambridge and Fort Anne.
The
I think-
tax collection should probably be done over what we thought.
I would think the tax collection would change.
That's the only
It hasn't
one.
happened yet. There's been occasion where the state reduced the match by 5%, as they did with other projects for a COVID reason, which would maybe getting that back, I saw on some of the other ones, so. That's good.
Can I comment on having been part of the shared services? The Cambridge Town Assessing, that was a disappointment because the part about it being a set calendar year was not really presented to us when you started. And since your assessors start the 1st of October, that was pretty much a kick in the teeth because you only got a short, what is that, October, November, December savings on it. But
Right,
it was
right.
better than nothing. I've been disappointed in all of the ones our town has participated in, but I probably shouldn't say that with the state rep there, but I'm here for your quorum.
That's why I want to talk, because Susan is here. I want her to realize that the reason that nobody's here is everyone's disgruntled that it hasn't really done what they thought it would do. Everybody budgeted and sold this to their individual boards to come up with a quarter, a third, a half of what they thought they were gonna get. And therefore, they're like, we're done. We're not interested in shared service. We've been bit too many times. And I think that's important that you know, so that the word gets out that we've either got to do this in a correct manner that everyone can buy into, or you're losing the opportunity for people to take advantage of this in something that should happen, whether there's actually the state involvement or not. We are all working together and we do share services, but your program, because the rules change, you move the goalposts every time we're started into something, it's making it so less people are interested in taking part. And so I think it is important that you hear that from us instead of just telling you how great it is.
Well, if I can jump in here too, I think that the program was sold that the county, the assessments that were done would not cost the county any money. What ended up happening was towns that were not involved in the reassessment got to pick up some of the burden from towns that were expecting to get some amount, and the county made up the difference, and that penalized residents from the other part of shared services who couldn't share in that. So that causes more disgruntlement.
Christopher.
There.
I guess I'm unclear about the last,
So
Cons-
when we passed when the assessment was done for the 5 towns, the county was the amount coming in
reval.
from the shared service reval.
Yes.
There was 5 towns involved. The 5 towns were given a certain amount they would have to cover. When the amount coming out was reduced, there was a gap between that and the amount by the company that did it, and ended up the county taxpayers picked up the balance of it because some of the towns couldn't afford that, couldn't afford the huge increase in the reval. So then taxpayers who didn't benefit from the service ended up picking up for those 5 towns.
Okay, I see.
So there's a few things we can work on.
Is the program calendar or fiscal?
It's either calendar or July to June.
July to June. Okay.
And that's a recent change.
Senior shuttle van, I think it's out because you bought the used van.
Yeah, no, that's because we had no other choice.
Yeah, so if you had bought a new one,
We're gonna buy a new one, but we've been told we have to wait till the first quarter of next year. before they become available.
Okay,
So if we end up buying a new one for $30,000,
we should put it in the plan, if you're gonna do that.
that's our plan, is to do it probably March or April of next year.
Yeah.
So is that
Yep,
this
so we
year
just,
or next year?
you should repeat it in the shared services plan that we're putting together now.
Okay, you put it in there because our
Yeah.
intention is still might not be a vehicle available.
Yeah.
But we're gonna try to make.
So if you still plan on buying a new one,
Yeah,
then
we
that's
And
perfect.
it should make it now a year, if it's supposed to come in March, you might have it by December.
So the savings in the
No,
town and the
even
village
so-
aren't buying
Don't put it out this fall because you will never get it anyway. There's a bunch of vehicles being made this fall. Try to find something in the spring. March or April. All right, so you put that in?
Yeah, so basically it's just a repeat of what wasn't able to
Correct.
happen
Correct.
this year because you couldn't get.
Get a Band-Aid on it and we're still on.
Yeah, so it'll be exactly the same project
So I
essentially.
like
It's
to
just
do that.
happening. Absolutely.
Okay.
That sounds good.
Yeah,
And
you
the,
wouldn't get a dime for what you just bought.
right, because it's already fully depreciated, that's for sure. So it's the difference, the savings is instead of the village buying a van and the town buying a van, you're sharing a van, so you get basically the savings of one van depreciated over the life of that.
Thanks.
More than 6 years. But you should get something.
It's probably too late, but as our relationship with our county youth bureau is that any kind of shared service.
We discussed that,
It is too late because it's already
That's what
happened.
it has to be new, yeah, and since we were just, they were paying us. It would have been maybe for them,
Yeah, there wouldn't be a savings to wash
It would
it.
be savings for them.
right?
Well, I don't care shared savings with the Boarding County.
Honestly, I don't even know. if
No, I
there
don't
was
have a problem with that
savings
either,
because
but I
I
think
believe
they
Mike
would've had
said
to
they
spend
didn't
it.
have staff
And their
providing
plan.
Right,
services.
I think they had to submit that in their plan for that to happen.
And they would have been the ones that, they would have
I just-
benefited, yeah.
It just popped in my head.
No, that's a good. point.
And two counties can work together in a plan, but it's already started.
But they didn't have a department that was actually providing those services prior. They didn't provide.
Oh,
those
that's right.
services. We just
New
started doing
services
it
are
for
not
them.
gonna work.
The no baseline.
There's no basin.
That's the issue that comes up a lot, no baseline. If you don't have the thing already, you need to be able to demonstrate what it would cost you to have the thing or the
They were
service.
providing services before.
But it could be avoided, it sometimes could be avoided costs.
Avoided cost, yeah.
Avoided costs, it could fall into that bailiwick rather than somebody starting on their own.
Yeah, but still gotta prove, I guess my point is just you still gotta prove what the avoided cost, the amount of the avoided cost. You gotta
Right,
prove
right.
But it would be.
So it's hard to come up with that figure.
Right, right. And
Could
so
maybe
that's
look at
just-
similar counties or,
Right, we're doing RFP for the service and then if you realistically did an RFP for a service that you wanted in your town and said, ooh, that's way too much. Let me see if the
Right.
county does something for me, then that would be good.
right?
You did an RFP for a service in your town, like
IT.
IT,
Do work.
and you got a provider of IT services, help you with cybersecurity, help you design your computer network, whatever, you hire Geek Squad, something like that, and they say, okay, we'll do this for, $20,000 a year. And then you come to our county IT department and you say, Terry, can you do any better than this? And she says, sure, we can do that for 10. Whatever, then that would be, you can demonstrate that by the county providing the service for you, you're saving money. Because you have a known cost and you know how much you're saving, or a known thought.
Yeah, we have to get it in the plan if it's coming next year.
Yeah, so now we're putting in the plan, things we're gonna do next year, right? They're gonna start next year.
When do we have to finalize this?
We have another
November
panel.
1st.
Yeah, we have another.
Not today.
Schedule.
November 1st, like, we do a draft, so it would be nice to have it by November 1st. We can still change it until.
I'm not sure what I'm gonna say, but you might. Or it might be the other way around. I might say, I might think.
I think she's gonna raise it up.
But it's an area of interest.
Well, there's a couple of areas and then.
Between the accounting services and cybersecurity.
Yeah.
there might be some
Anything to do with. I can't believe I'm saying, the county, the IDA and the bridge. Be shared, because they're not a.
Yeah, I don't think,
Government
Um,
entities.
I don't think we can partner with IDA.
They are an authority. They asked Dave, he's an authority. Because it's not-
Industrial development.
We weren't leaving.
Right.
15% delta is measurable.
Let's ask
We're gonna
Susan.
save the tax.
Susan's here, let's ask Susan.
It's gonna save the taxpayers money.
Industrial.
To taxpayers.
What, I
Yes.
couldn't hear the discussion because there was a lot of voices at once.
We're not talking a secret meeting up here.
We have-
That's all right. That's
We
all
have
right.
a
That's
bridge.
the reason you're supposed to have these panel meetings so everybody can throw things around.
So we have a bridge that the IDA is building. And the county is gonna be the lead agency, and it's a dual county IDA, not that that does or doesn't make a difference. But by the IDA coming through the county would have to pay 5%, the IDA will actually pay it, but the 5% that Marcia Sully doesn't cover. If the IDA did it on their own, the state would pay 80% and they would have to pay 20%. So the IDA is gonna save 15% out of this deal. Is that a shared service thing, or is the IDA not being a government, not taxing authority? They are a government entity, but they're not a taxing authority. Does that make a difference, or does that qualify?
I have heard of an IDA getting reimbursement, but I don't believe it's on the list of eligible partners. So I would have to look at that.
We don't care. It's around people.
But it sounds like you have a good distribution now with the IDA, right? It sounds like it might be. You have to evaluate sometimes which is the best way to go to provide real savings.
Well, that's the
So-
thing, all of our entities already do shared services.
Yeah, I know.
This part where you're trying to promote it, it's hard to promote more than we already do, because we do it because it saves us money to start with. That's why we're here.
Right. Okay, let me look at that and I'll get back with Sue and try to get more particulars, okay?
Okay.
A new service, not current. There might be opportunities, especially between sewer district and town of Kingsbury with their new way that they're looking at that, the extended sewer one.
Yeah.
The Kingsbury sewer district. And it's working with our sewer district. We may want to look at some of the activities. Because they're partnering now, or planning to partner in a way that they hadn't before.
So you want all supervisors and mayors here to tell you things that they're on their agenda that they could throw into here.
Yes.
And there's 6 of us here. So
Or think about it,
Yeah.
think about it, yeah.
kind of the opener for
Okay.
plan for this year. Mostly we're putting, we know we have to put the plan together because we want to put the 40 shared barn in it.
Okay.
So since we're doing that, if anybody, like when we can do the van thing, so that's good. And other stuff that comes up, but as Cassie mentioned, dates are a thing. So if your new program starts in October, then you only get those 3 months.
Gotcha.
If your new program, so what you could do is my new program starts in October, let's do a temporary arrangement until January and then finalize our thing and officially start in January, just keep that in mind if you're doing some kind of service. Rather than equipment purchase is perfect, you just do it in the year and happy day. But some of these more like the sewer district stuff, or what was the answer in the IDA? No, yes, maybe.
I'm going to find out more about how that one project made it into the loop. There might have been another piece I wasn't aware of, but I'll try to figure that out. And then you'd have to figure out which was the best way for you to go, where you're going to find the most savings. Because this is a tool and there's other tools as well.
The one that got funded probably was a savings to the county. This is a savings to the IDA. So
right?
That's a little bit.
And we are applying for LGE grant for that for, shared barn project, and if we receive that, it will wipe out our shared services amount we would be eligible for.
So you can't stack in.
No,
They can't, not against, only
It's
COVID
not a
related,
bad-
only COVID related.
Okay.
So
So
there,
any grant comes right off the top.
yeah, so we're submitting the barn, even though we're pretty hopeful we're gonna get the grant. And this, shared services won't really come into play. So we're hoping.
Right, because it's smaller.
Because the grant
of
is more.
depreciation turned out to be quite a small one. And we would get, and way less than the grant. And if the grant is 200,000, definitely way better shared services.
Now, because of the conversation.
What's your savings X
So
for the grant? And then-
long. Potential 23 plan for 24 execution. Have we ever talked about pooled enterprise fleets or pooled enterprise health insurance with the county and towns?
We've talked about health insurance.
Yeah, but it was never legal.
Because with Matt's,
We never do
It's
it.
never legal.
we've done a couple of agreements with towns now that got stuck in some kind of transportation issue. Have we ever looked at expanding our fleet services beyond our own carpool
That's
and
never,
expanding that out so that
Anytime-
towns then they're then paying a fleet enterprise fee rather than buying X amount of cars or X amount of trucks.
anytime we tried to do anything here, it's never had the support of the board.
But I don't know, but it's a,
I don't think it's been looked at it that direction.
it's
But
not a
any
conversation that I'm
direction
saying.
we have looked at is just falling flat. But we looked at the health insurance one, and we were always told it was illegal.
But there's no examples of health insurance pools in the state.
Yeah,
There are models.
well,
out
there
there.
was even then when they told us. It was illegal. We could search them without them.
Susan, can I ask you if you have seen successful, I guess, health insurance sharing between like a county and towns?
That is an issue that is beyond the Department of State. We have seen Medicare Advantage plans where the partners were the counties and the state. Onondaga County did that recently with the city of Syracuse and the Syracuse City School District, and a couple of towns and the county as partners. There's some restrictions on healthcare consortiums. We have seen people join already established consortiums like the Tompkins County Consortium, which you could do. That's an option, but it's really an issue with financial services that there are requirements that you can establish. You can establish a plan and there's a set aside, and there's kind of a lengthy process. We have heard from counties all around the state that they would like that changed. And we have also tried to see what we could do to make those changes, passing along the concerns that we hear, at tables like yours. So there have been some things done in the area of healthcare, but not a countywide consortium.
What I had to ask.
So as much as we want shared services, when it's really advantageous to it, we're not allowed to.
Well, that's an insurance department regulation, I'm afraid. It was meant to make sure that if you had, as I understand it, that communities wouldn't become bankrupted by these.
We're getting bankrupt.
You have to have a larger set aside. So if you had a very small group, you might have a lot of volatility in that.
So
without
we
a
go
large
out
set aside.
slowly,
There is a process to do it. There is a process to do it. Most counties have found it to be kind of burdensome. So it's not illegal, but it's a lengthy process. But we do see a lot of communities joining. As we said, the Tompkins County Healthcare Consortium, where they've already done the work. In that case, it would have to be in the Tompkins County plan and in your plan, if any of your communities were to do that.
I guess I'd like to bring up the subject of dog control, because it has come up a couple times in committee meetings, and we just sent out a survey, which we have the results back, and I'll probably bring to government ops, I'm thinking, next month, to talk about what towns have a need for ulterior measures for dog control services. It brings up a lot of questions as far as dog control officers. We have towns that have, well, they're not sharing, but they have the same dog control officers in their towns. As far as the county providing those services, dog control officer is a civil service position. So therefore, it would have to be a county employee if we were to have a dog control officer, and that person would have to be on the payroll. It wouldn't be a contracted service. Possibly the place we can do an RFP for the actual establishment that houses the animals, or the dogs, I should say. So that would be an option, but I don't know that that would be a savings, because it would cost the county quite a bit, I believe. I don't know if there's any way around that. So I don't know that it would actually qualify for shared services. Have you seen any successful instances of that? Susan, sorry to keep asking.
Okay, a lot of discussion around the state on this, but nobody has put it into a plan. No one's it's actually been in plans, but not carried through because of, various factors. So it's definitely a hot topic, and it's one that everybody's facing. We see that, and we also see EMS services as things that are happening all around the state in every community.
Have you ever used shared services money when they did the shared services with EMS?
Essex County received a sizable grant in a different program recently.
Right, not through shared services, though.
Not through shared services, but we did have it in a shared services plan in Otsego County last year. So they were, were in the process of trying to move together to enact it during this calendar year. But we hear it is a growing problem all around the state.
That's due to state restrictions and requirements.
Okay.
It's all the training they're
There's
requiring.
there's a lot of factors, right?
Yeah, the
But volunteer issue is a huge one.
Yeah. And then in our areas, we can only afford what volunteers because we're so spread out. And so once it goes paid, there's taxing districts seems to be the only thing we're able to do.
Well, again, that's something that we're seeing around the state, people trying to come up with ways to make sure that they don't have long waits for ambulance services when volunteers are not available.
Yep.
Those are the only items I could think of that we've talked about in the past. Anyone else have any ideas of? Otherwise, we'll just convene again in October. We have another shared service meeting then on the 13th after finance.
And in between, if anybody has anything, bring it to Melissa or I. about it, and if we don't know the answer, we'll ask Susan.
Okay,
Thanks, Susan.
Thank you.
Thanks a lot, Susan, for joining us.
sure.
Thank you. Okay, yeah, I think we're done, right?
Adjourned.
Adjourned.